Addiction and Recovery Podcast. Understanding the terms that shape recovery.
Many people may find themselves in situations where they are unaware of a problem looming just beneath the surface. This can be especially true in the context of substance use and behavioral health. Welcome to today's discussion, where we explore some of these cognitive and psychological factors that can cloud our perception and hinder our ability to recognize an issue. Before we dive in, it's important to clarify that this segment is intended for educational and reference purposes only. It is not meant to serve as medical, psychological, or professional advice. Have you ever noticed how certain behaviors can become normalized in our lives? It's interesting to think about how we sometimes overlook things that may be problematic simply because we are accustomed to them. This is not a matter of intelligence or capability. Rather, it involves a complex interplay of perception, information processing, and emotional regulation. One common misunderstanding is the assumption that if someone does not recognize a problem, they are intentionally ignoring it. This perspective can be quite limiting. It often fails to consider the unconscious biases or restricted viewpoints that shape our awareness. In fact, a problem can exist independently of one's recognition of it. Just because someone isn't aware of an issue doesn't mean it isn't there. Take, for example, how access to information can influence our understanding. An individual may not see a decline in their work performance as a problem if they lack historical data for comparison. Without that context, they might interpret their current situation as normal, even if it's a sign of something larger at play. Similarly, cultural norms can shape our perceptions. In some environments, high levels of stress at work might be seen as a badge of honor rather than a signal that something needs to change. It's crucial to remember that just because someone isn't recognizing a problem doesn't mean they lack motivation to address it. It can also lead to the misconception that solutions are straightforward once a problem is identified. The reality is often much more complex. Recognizing an issue is just the first step. Understanding how to navigate it can be a challenging journey. Understanding these dynamics is essential not only for individuals in recovery, but also for those supporting them. Awareness of these cognitive factors can foster compassion and patience, encouraging open dialogues about challenges without judgment. For those interested in pursuing a career in substance use disorder counseling or behavioral health, grasping these concepts can be incredibly beneficial. They may provide insight into the barriers clients face and help prepare future professionals to offer more effective support. As we close today's discussion, it's worth noting that topics like these are often explored in addiction counseling education. Programs, such as those offered at InterCoast colleges, delve into the intricacies of behavioral health and recovery support. If you're curious about educational pathways in this field, you can visit intercoast.edu to learn more. Thank you for joining us today.